the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe.
9 weeks pregnant. Your baby's development. This week, your little one, now officially known as a fetus, is looking less and less like a little pink blob and instead has more of a mini baby shape. Even the tail that had been present in earlier weeks has almost disappeared. Tiny facial features continue to develop this week, including a more prominent nose and eyelids. Up top, the head is large compared to the body, while down below, little toes are now visible. Internal organs are also forming, including the digestive and reproductive systems, meaning that the intestines as well as testes or ovaries are growing. Now that you're 9 weeks pregnant, your little one may be starting to move, thanks to some recent muscle development. But you'll have to wait until sometime in the second trimester to actually feel these movements. The size of the fetus at 9 weeks pregnant. At 9 weeks, the fetus is about the size of a cherry. Your little one may now measure 0.6 to 0.7 inch long and weigh about 0.12 ounce. Mom's body at 9 weeks pregnant. Symptoms at 9 weeks pregnant may include changes to your breasts. They are probably fuller, heavier, and tender to the touch due to the enlargement of your milk glands and an increase in fatty tissue. Although your breasts will likely continue to grow throughout your pregnancy, the sensitivity will usually subside once your body adjusts to the surge of pregnancy hormones. 9 weeks pregnant, your symptoms. At 9 weeks pregnant, here are some of the symptoms you may be experiencing. Growing waistline. Your belly at 9 weeks pregnant may not have a pronounced, rounded look, but your pre-pregnancy clothes are probably feeling a little snug due to a combination of a thickening waistline and some bloating brought on by your old friends, pregnancy hormones. Spotting. You may see some spotting in the first trimester. Call your healthcare provider if you see any more than a few drops of blood. Mild uterine cramping. This is a time of rapid change in your body, and you may experience mild uterine cramping. If the cramping is severe, or if you feel other pain like lower back pain, call your doctor to rule out any problems. Morning sickness. If you haven't experienced morning sickness by now, you could be one of the lucky ones who will avoid this common symptom. But if you do get morning sickness, keep on eating smaller meals frequently throughout the day and remember to stay hydrated. Being hungrier. You may start to feel a bit hungrier than usual, so munch on some extra snacks, keeping in mind that you only need to add about 300 calories to your daily intake. Foods like fruit, cereal, and yogurt are great choices. Food cravings and aversions. Your sense of smell is heightened now, and foods and smells you once enjoyed may now seem unpleasant. On the flip side, you may now find you crave certain foods. You can feel free to indulge any food cravings you have, as long as they seem healthy. Just make sure you're sticking to a balanced diet. Always talk to your healthcare provider if you crave non-food things like dirt or chalk. Fatigue. Thanks to an increase in your levels of the hormone progesterone during the first trimester, you may find yourself sleepier than usual. Rest as much as you can during the day, particularly if you're having trouble sleeping at night. Feeling moody. If you're feeling on top of the world one minute and doomed the next, you can thank pregnancy hormonal changes. Speak to loved ones about how you're feeling. It may help you feel a little better, and seek help from your healthcare provider if your mood swings are severe. Frequent urination. Yes, those extra trips to the bathroom may still be a part of your day as your baby grows and your uterus presses against your bladder. This need to pee more often may also be caused by the increased volume of blood in your body, which makes your kidneys work overtime. Don't drink less water, as staying hydrated is important, but try to go to the restroom before you head out the door or before you go into a long meeting. If you notice a burning sensation or pain when you pass urine, call your doctor, because this can be a sign of a urinary tract infection. Acne. If you're experiencing acne now and didn't before you got pregnant, or if your acne is worse now than before, it may be one of your pregnancy symptoms. Read up on how you can combat some of those spots and blemishes, and remember that it's just one of those pesky pregnancy hormone-related symptoms that should clear soon after your baby is born.
Menopause and Hormonal Changes Guide Tips, Intro. Hey there, wonderful people. Welcome back to Healthcare Lover. Today we're diving deep into a topic that affects so many incredible women out there. Menopause and hormonal changes. Yes, we're unraveling the mysteries behind those 15 crucial points. So, grab a cup of tea, get cozy, and let's get started. Point number one, understanding the basics. Menopause is a natural biological process that every woman goes through, typically in her late 40s or early 50s. It marks the end of the menstrual cycle and fertility. But what exactly happens during this time? Let's find out. Point 2. Hormonal roller coaster. As women approach menopause, there's a significant drop in estrogen and progesterone levels. These hormonal fluctuations can lead to a variety of symptoms, from hot flashes to mood swings. Ladies, you are not alone in this. Point 3. Impact on mood and emotions. Hormones play a crucial role in regulating our emotions. During menopause, the hormonal imbalance can contribute to mood swings, irritability, and even anxiety. It's essential to acknowledge and address these changes. Point 4. The infamous hot flashes. The notorious hot flashes. We've all heard about them, but what causes these sudden bursts of heat? Stay tuned as we explore this in point number 4. Point 5. Sleep disturbances. Menopause often brings along sleep challenges. From insomnia to night sweets, getting a good night's sleep can become quite the struggle. But fear not, we'll discuss strategies to help you catch those ZES. Point 6. Weight gain and metabolism. Hormonal changes can affect metabolism, making it easier to gain weight, especially around the abdominal area. But fret not, we've got tips to help you maintain a healthy lifestyle during this phase. Point 7. Bone health. Estrogen plays a crucial role in maintaining bone density. With its decline during menopause, the risk of osteoporosis increases. Let's delve into how to support your bones through nutrition and lifestyle choices. Point 8. Memory and cognitive changes. Some women experience changes in memory and cognitive function during menopause. We'll explore these changes and share strategies to keep your mind sharp. Point 9. Skin and hair transformations. Hormonal changes can impact the skin's elasticity and lead to hair thinning. But worry not, we've got beauty tips to help you embrace and enhance your natural radiance. Point 10. Sexual health during menopause. Let's address the elephant in the room. Changes in hormones can affect libido and vaginal health. We'll discuss open communication with your partner and ways to maintain intimacy. Point 11. Managing stress. Menopause can be a stressful time, but stress exacerbates symptoms. Learn effective stress management techniques to navigate this phase with grace. Point 12. Hormone replacement therapy, HRT. For some women, HRT can be a game changer in managing menopausal symptoms. We'll explore the pros and cons to help you make an informed decision. Point 13. Nutrition and supplements. A balanced diet and specific supplements can alleviate menopausal symptoms. Let's explore the foods and nutrients that can make a positive impact on your well-being. Point 14. Exercise and its role. Regular physical activity can make a significant difference in how you experience menopause. Discover the types of exercises that can boost your mood and overall health. Point 15. Embracing the journey. Menopause is a transformative period, and embracing the changes is key. We'll leave you with empowering tips to celebrate this new chapter of life. Outro. And there you have it, folks. 15 points to demystify menopause and hormonal changes. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Healthcare Lover for more insightful content, and hit that notification bell so you
Start with a warm welcome and a brief introduction to the topic. Mention the importance of understanding ovulation for those trying to conceive or practicing contraception. Point 1. Know your menstrual cycle. Explain that ovulation occurs in the middle of your menstrual cycle. Discuss the typical menstrual cycle length, which is around 28 days, but can vary. Emphasize that tracking your cycle is essential. Point 2. Start with day 1. Explain that the first day of your menstrual bleeding is considered day 1 of your cycle. Point 3. Calculate your cycle length. Instruct viewers to record the number of days between the start of one period to the start of the next for a few months. Highlight that cycle length can vary and may not always be the same. Point 4. Determine your ovulation window. Mention that the ovulation window is usually around the midpoint of the cycle. To find it, subtract 14 from your average cycle length. For example, if your cycle is 28 days, subtract 14 to get 14. Your ovulation window is around day 14. Point 5. Use ovulation prediction kits. OPKs. Explain that OPKs can help pinpoint ovulation more accurately. Describe how to use OPKs by following the package instructions. Point 6. Monitor basal body temperature. BBT. Discuss how a woman's basal body temperature rises slightly after ovulation. Instruct viewers to use a basal thermometer and take their temperature every morning before getting out of bed. Point 7. Track cervical mucus changes. Explain that cervical mucus changes in consistency throughout the menstrual cycle. Describe how to observe and record these changes. Point 8. Pay attention to ovulation symptoms. Mention common symptoms like mild pelvic pain, breast tenderness, or heightened senses. Stress that these symptoms are not definitive but can be additional indicators. Point 9. Keep a ovulation calendar. Encourage viewers to create an ovulation calendar. Use a calendar or a smartphone app to track cycle length, OPK results, BBT, and other relevant data. Point 10. Be patient. Remind viewers that it may take a few months of tracking to accurately predict ovulation. Highlight the importance of patience and persistence. Conclusion. Summarize the key points discussed in the video. Remind viewers that understanding their ovulation cycle can be helpful whether they are trying to conceive or manage contraception. And with a call to action, encourage viewers to subscribe, like, and share the video. Invite them to ask questions or share their experiences in the comment section.
Title: 27 Foods to Avoid During Pregnancy. Introduction. Welcome back to our channel. Today, we're discussing crucial information for expectant mothers. If you're pregnant or planning to be, it's essential to be mindful of your diet for a healthy pregnancy. Point 1. Raw seafood. Raw seafood, like sushi and oysters, can pose a risk of contamination with harmful bacteria or parasites. Opt for fully cooked options. Point 2. High mercury fish. Avoid high mercury fish, such as shark, swordfish, king mackerel, and tilefish. Mercury can harm the developing nervous system of the fetus. Point 3. Undercooked eggs. Ensure that eggs are fully cooked to avoid the risk of salmonella infection. Point 4. Raw or undercooked meat. Raw or undercooked meat may harbor bacteria or parasites. Cook meat thoroughly to eliminate these risks. Point 5. Unpasteurized dairy. Unpasteurized dairy products can contain harmful bacteria like Listeria. Stick to pasteurized options for safety. Point 6. Excessive caffeine. Limit caffeine intake to avoid potential complications. Opt for decaffeinated beverages when possible. Point 7. High sugar and processed foods. Excess sugar and processed foods contribute to unnecessary weight gain. Focus on whole, nutrient-rich options. Point 8. Unwashed produce. Ensure thorough washing of fruits and vegetables to eliminate any potential contaminants. Point 9. Alcohol. Alcohol can cause developmental issues, so it's best to abstain during pregnancy. Point 10. Artificial sweeteners. Some artificial sweeteners may have uncertain effects during pregnancy. Choose natural sweeteners in moderation. Point 11. Deli meats. Deli meats may carry the risk of Listeria contamination. Heat them thoroughly before consumption. Point 12. Soft cheeses. Avoid soft cheeses like feta, brie, and blue cheese, as they may harbor harmful bacteria. Point 13. Excessive vitamin A. High doses of vitamin A found in some supplements and liver can be harmful during pregnancy. Point 14. Raw sprouts. Raw sprouts may carry a risk of contamination, so it's advisable to avoid them. Point 15. Unwashed hands and surfaces. Practicing good hygiene, including washing hands and surfaces, helps prevent foodborne illnesses. Point 16. Excessive salt. High salt intake can contribute to fluid retention. Opt for balanced sodium levels. Point 17. Herbal teas. Some herbal teas may have adverse effects during pregnancy. Consult with your healthcare provider before consumption. Point 18. Excessive intake of vitamins and minerals. Avoid excessive intake of certain vitamins and minerals, as it may lead to complications. Point 19. Excessively hot baths. Hot baths can raise your body temperature, potentially harming the developing fetus. Stick to warm or lukewarm baths. Point 20. Raw cookie dough. Raw cookie dough may contain raw eggs, posing a risk of salmonella. Bake cookies thoroughly. Point 21. Unwashed lettuce. Ensure lettuce and other leafy greens are thoroughly washed to remove potential contaminants. Point 22. Excessive tuna. While fish is beneficial, too much tuna can lead to excessive mercury intake. Choose low mercury options. Point 23. Processed junk food. High in additives and preservatives, processed junk food should be limited for a healthy pregnancy. Point 24. Excessive exercise. While staying active is essential, avoid excessive or high-impact exercise without consulting your healthcare provider. Point 25. Certain medications. Always consult your doctor before taking any medications during pregnancy. Point 26. Smoking. Smoking poses severe risks during pregnancy. Quitting is the best option for the health of you and your baby. Conclusion. Remember, a healthy diet and lifestyle are crucial during pregnancy. Consult with your healthcare provider for personalized advice. If you found this information helpful, don't forget to like, subscribe, and share. Until next time, take care.
Hello, expecting moms. Congratulations on reaching the third trimester of your pregnancy. As your due date approaches, it's important to stay active and maintain a healthy lifestyle. Today, we have compiled a set of safe and effective pregnancy exercises that will help you stay fit, reduce discomfort, and prepare your body for labor. Remember to consult with your healthcare provider before starting any new exercise routine. Let us get started. Point 1. Warm up. Begin with a gentle warm-up to increase blood flow and flexibility. March in place for 2 minutes to warm up your legs and get your heart rate up. Perform shoulder rolls and gentle arm circles to loosen up your upper body. Point 2. Pelvic tilts. Pelvic tilts help relieve lower back pain and strengthen your core. Stand or get on your hands and knees. Gently tilt your pelvis forward and backward, arching and rounding your back. Repeat for 10-15 reps, holding each position for a few seconds. Point 3. Squats. Squats are excellent for preparing your pelvic floor and thighs for labor. Stand with your feet shoulder width apart, toes pointing slightly outward. Slowly squat down as if you're sitting in a chair, keeping your back straight. Exhale as you come up and squeeze your glutes at the top. Aim for 3 sets of 10-12 squats. Point 4. Modified push-ups. Modified push-ups help strengthen your arms, chest, and core without straining your belly. Position yourself on your hands and knees. Lower your chest, tower chest. Point 5. Kegel exercises. Kegels strengthen the pelvic floor muscles, which can ease delivery and postpartum recovery. Sit or lie down comfortably. Squeeze your pelvic muscles as if you're trying to stop the flow of urine. Hold for 5-10 seconds and release. Aim for 3 sets of 10-15 repetitions. Point 6. Side-lying leg lifts. Side-lying leg lifts target the hips and outer thighs. Lie on your side with your head supported by your arm. Lift your top leg slowly, keeping it straight, and then lower it back down. Perform 12-15 reps on each side for 2 sets. Point 7. Cat-cow stretch. The cat-cow stretch helps improve flexibility and reduce back pain. Get on your hands and knees, aligning your wrists under your shoulders and knees under your hips. Arch your back while inhaling, bringing your head up cow position. Round your back while exhaling and tuck your chin towards your chest cat position. Repeat for 10-12 breath cycles. Conclusion. Congratulations, you've completed a safe and effective pregnancy workout for the third trimester. Remember to listen to your body and avoid any exercises that cause discomfort or pain. Staying active during pregnancy can lead to a smoother labor and quicker postpartum recovery. Don't forget to hydrate and get plenty. If you enjoyed this workout, consider subscribing.
Unlocking the secret to boost female fertility. Top 20 foods for improved egg quality. Introduction. Hello everyone. Welcome back to our channel. Today we have an incredibly important topic to discuss, something that many women may find valuable on their fertility journey. We'll be diving into the top 20 foods that can significantly enhance female egg quality. If you're ready to unlock the secret to boosting your fertility, stay tuned. Segment 1. Importance of female egg quality. Before we get into the list, let's understand why female egg quality is crucial for conception. The quality of your eggs plays a pivotal role in fertility, affecting not just the likelihood of conception, but also the health of the baby. Now, let's jump into the first set of foods that can make a positive impact. Segment 2. Dark leafy greens. Our number 1 on the list is dark leafy greens such as spinach and kale. Packed with essential nutrients like folate and iron, these greens promote optimal egg development and overall reproductive health. Add a generous serving of these greens to your diet for a fertility boost. Segment 3. Berries. Next up, we have berries. Blueberries, strawberries, and raspberries. Loaded with antioxidants, these little powerhouses protect your eggs from oxidative stress, enhancing their quality. Snack on a handful of berries daily to give your fertility a sweet and nutritious kick. Segment 4. Avocado. Moving on to number 3. Avocados. Rich in monounsaturated fats and vitamin E, avocados support hormonal balance and nourish your reproductive system. Incorporating avocados into your diet can positively impact your egg quality over time. Segment 5. Fatty fish. Let's talk about fatty fish like salmon and mackerel. omega-3. Fatty acids found in these fishes are essential for reproductive health. They not only improve egg quality, but also contribute to a healthy pregnancy. Aim for at least 2 servings of fatty fish per week. Segment 6. Nuts and seeds. Nuts and seeds come in at number 5. Almonds, walnuts, and flax seeds are rich in omega-3s and antioxidants, promoting better egg quality. Snacking on a handful of these daily can be a simple yet effective way to boost your fertility. Segment 7. Quinoa. Quinoa takes the 6th spot on our list. This whole grain is a fantastic source of protein and essential amino acids, supporting overall reproductive health. Swap out refined grains for quinoa to give your body the nutrients it needs for optimal eggs quality. Segment 8. Greek yogurt. Number 7 is Greek yogurt. Packed with protein and probiotics, Greek yogurt promotes a healthy gut, positively influencing your reproductive system. Choose the unsweetened variety for maximum benefits. Segment 9. Broccoli. Broccoli, our 8th contender, is rich in folate and other crucial nutrients. It aids in regulating hormones and supporting healthy egg development. Steam or stir-fry broccoli as a tasty and nutritious side dish to boost your fertility. Segment 10. Lean protein. Lean protein sources like chicken and turkey make it to number 9. Protein is essential for overall health, and incorporating lean sources into your diet helps provide the necessary building blocks for optimal egg quality. Segment 11. Eggs. It might sound cliche, but eggs are our number 10. They are a fantastic source of high-quality protein, choline, and antioxidants. Including eggs in your diet can contribute to improved egg quality over time. Segment 12. Citrus fruits. Let's move on to number 11. Citrus fruits like oranges and grapefruits. Packed with vitamin C, these fruits support the production of collagen, a crucial component for healthy eggs. Add a citrusy twist to your diet for a fertility boost. Segment 13. Pumpkin seeds. Pumpkin seeds claim the 12th spot on our list. These tiny seeds are rich in zinc, a mineral essential for reproductive health. Snacking on pumpkin seeds can contribute to better egg quality and hormonal balance. Segment 14. Beans and lentils. Beans and lentils come in at number 13. These plant-based protein sources are high in fiber and essential nutrients, supporting hormonal balance and reproductive health. Incorporate a variety of beans and lentils into your meals. Segment 15. Sweet potatoes. Number 14 is sweet potatoes. Packed with beta-carotene and vitamin A, sweet potatoes support healthy egg development. Swap regular potatoes for the sweet variety to enhance your fertility. Segment 16. Tomatoes. Tomatoes take the 15th spot, rich in lycopene, an antioxidant. Tomatoes support reproductive health by protecting eggs from damage. Add fresh tomatoes to your salads or enjoy them in cooked dishes. Segment 17. Asparagus. Asparagus claims the 16th spot. This green veggie is loaded with folate, promoting optimal egg quality and hormonal balance. Steam or roast asparagus for a delicious and fertility-boosting side dish. Segment 18. Beets. Beets at number 17 are rich in nitrates and antioxidants. They support blood flow to the reproductive organs, positively influencing egg quality. Incorporate beets into your diet for a natural fertility boost. Segment 19. Lean red meat. Lean red meat makes it to number 18. Rich in iron and zinc, red meat supports overall reproductive health. Choose lean cuts and enjoy them in moderation to enhance your fertility. Segment 20. Water. Last but not least, staying hydrated is crucial for optimal fertility. Drinking enough water ensures proper circulation, supporting the delivery of nutrients to the reproductive organs. So, don't forget to keep yourself well hydrated throughout the day. Conclusion. And there you have it, the top 20 foods to improve female egg quality. Remember, making these dietary changes is a journey, and consistency is key. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more valuable content. Wishing you all the best on your fertility journey. Until next time, take care. Outro. Thank you for watching, and we'll see you in the next video. Stay healthy and happy.
Welcome to our review of in vitro fertilization, or IVF, a common treatment option for couples attempting to conceive. First, a basic explanation of how IVF works. The procedure starts with a woman taking medicine to encourage the development of numerous eggs in her ovaries. Once the eggs are ready, they are extracted during a small surgical operation. Next, the eggs are fertilized with the partner's or a donor's sperm in a laboratory dish. The resultant embryos are then transferred to the woman's uterus, with the goal that at least one will implant and result in a healthy pregnancy. IVF is often advised for couples who have been trying to conceive for at least 1 year without success, or for those with a known reproductive condition such as blocked fallopian tubes or low sperm count. It's crucial to understand that IVF is not always successful on the first try, and numerous rounds may be required to obtain a pregnancy. Additionally, IVF may be a physically and emotionally hard procedure, so it's crucial to have support and advice from a fertility professional and counselor. Whether you and your spouse are contemplating IVF, it's crucial to have a comprehensive examination and conversation with a fertility expert to see if it's the best decision for you. Thank you for watching. We hope this summary has been useful in understanding the fundamentals of IVF and the possibilities it has for families dealing with infertility.
Hey there, lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance, while excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for optimal fertility. Point 4. Avoid harmful substances. Smoking can decrease fertility in both men and women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine intake has been linked to reduced fertility, so consider cutting back. Point 5. Preconception health check. Before embarking on your pregnancy journey, schedule a thorough health checkup with your doctor. Discuss any pre-existing conditions, medications, or supplements you're taking that could impact fertility. Point 6. Stay hydrated. Drinking enough water helps maintain healthy cervical mucus, which plays a role in fertility. Point 7. Timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8. Communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. If you're having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion: thank you so much for joining us today as we explored these comprehensive tips for increasing your chances of getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content. 6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A tiny heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth.